Welcome to Monday's edition of COVID-19. I'm Min San-hee. Today we mark a special day designated for the air at the proposal of the Korean government to the United Nations. It's the first commemoration of the International Day of Clean Air for Blue Skies. Now, given the travel restrictions and relative economic inactivity, some claim that the skies have become cleaner amid the pandemic, but others are not so sure as they highlight the importance of seeking a balance between the health of the environment and that of the economy. We start the program now with the latest numbers on the pandemic with our Kwon So-ah. So how are we starting the work week? I hear there has been a further decline in the numbers for Korea on this Monday.
Right, Sunny. As of the fifth consecutive day, Korea has been reporting daily cases below 200, which government officials are assessing as a positive sign. Now, 119 is the figure that we're seeing today on this Monday, the lowest in 24 days. But as officials have been saying on Mondays, we also have to factor in that there are less tests conducted over the weekend.
Right, so I understand there are also a number of other factors that have to be taken into account according to health officials?
Right, Sunny, and that is one of those being the high percentage of untraceable transmissions. And according to Health Minister Bang Neung-hoo, as of this Monday morning, 22% of cases are of unknown origins. And so although we are seeing a downward trend, as we can see here, last Monday we had 248 cases, so in the mid-200s, and we have been seeing almost every day a decline in cases. Now we're at in the 100s, in the safe 100s. So despite all of these declines that we are seeing, there is another big concern. We are going to have the Chuseok holiday later this month, which begins at the end of this month, to be exact. And it's a 5-day period where many Koreans travel around the country, and that is why health authorities have asked them to refrain from traveling and also visiting their families or relatives this year if possible. And they also have designated that span as a special anti-coronavirus period. So that means less moving around across the country, these places that you can see all over the map, because we are continuing to see community spreads in most places of the country. And again, most infections were again concentrated in the metropolitan region, with 48 in the capital Seoul, 31 in Gyeonggi-do province, but quite a plunge in Incheon with only 1 case. So this region now accounts for 80 cases this Monday, which is some development we are seeing. Meanwhile, we had 108 cases that were local infections and 11 imported cases.
Right, so on the international front, is it? I hear that India has become the country with the second highest number of cases worldwide now.
Right, and that comes just a day after India has reported its highest daily case of infections. Over 90,000 cases were reported, and that's not only a record for India, but a global record. And with that, over 4.2 million cases were reported in India as of noon Korea time, with that surpassing Brazil and also being second after 6.4 million cases in the U.S., and Brazil follows after India. But what's noticeable is the relatively low death toll in India compared to its total caseload, and that is a reason why authorities there are saying reopenings in the country are reasonable. Meanwhile, we have some 600,000 cases in countries like South Africa and Mexico, and there are many resurgences in European countries which are actually protesting. Many people are protesting there against the wearing of face masks despite these resurgences. And there has been another record high figure in the UK with almost 3,000 daily cases reported on Sunday, which is a record high after late May. And the entire world now has over 27.28 million cases with 887,000 fatalities and over 19.3 million recoveries. And those are the figures I have for now, but I'll be back with more updates after the government briefing. Back to Sunny.
All right, so thank you for that. I'll see you back at the desk. Right, spring and autumn are the preferred seasons for large family events, including weddings here in the country. Yet couples who had postponed their big day from spring to autumn this year are now having to deal with a restriction under Level 2 social distancing that bans gatherings of more than 50 people indoors and 100 outdoors. So what options are available and what are the new approaches to this ancient practice of marriage amid the pandemic? We have answers in this report.
On August 19th, Level 2 social distancing measures were issued in the capital region. And these guidelines were soon extended nationwide, just 4 days later on August 23rd. As a result, many people were forced to call off or postpone their weddings, also triggering a number of disputes over cancellation fees. In response, the Seoul Metropolitan Government has decided to step in as a mediator to resolve the situation. The Seoul City Government recently held a meeting with a wedding association and a consumer rights group to discuss possible solutions, including waivers or discounts on wedding cancellation fees.
예식을 연기하고자 하시면 최대 내년 2월까지, 그리고 예식을 취소하는 경우에는 소비자가 부담해야 되는 위약금의 40%를 이제 업체에서 부담하게 되고요. 그리고 최소 보증 인원도 최대 40%까지 감면하는 방향으로 기준을 만들었습니다. 다만 이 적용하는 대상은 지금 사회적 거리두기 2단계일 때 예식하는 그 대상으로 한정했기 때문에
Soon-to-be-wed couples have also come up with interesting solutions of their own, like getting married online.
요즘 상황이 워낙 코로나 때문에 이제 50인 인원 제한도 걸리다 보니까 정상적으로 이제 시행할 수 없는 이제 환경이 되니까 친구들이 오기도 힘들고 코로나가 언제 또 종식이 되거나 이제 예측이 안 되는 상황이라서 이제 무작정 미룰 수만 없다는 판단이 들어가지고 이제 그래도 진행을 하게 됐습니다.
Only a small number of guests were invited to the physical venue. But messages from friends and loved ones congratulating the newlywed couple are streaming in via an online chat room.
최근 코로나19로 인해서 각종 모임이나 행사가 금지되고 있는데 가장 큰 피해를 입는 업종이 결혼식이라고 생각했습니다. 사회적 거리두기 2단계 조치 후 하루에 약 200~300통의 문의가 오고 있습니다.
Although many of the guests couldn't be at the wedding physically, they are truly sharing this moment together as one.
이제 온라인으로라도 이렇게 준비해서 친구들이 볼 수 있게 돼서 정말 그래도 상황이 이렇지만 그래도 기쁜 마음이 있습니다. 보통 이사할 때나 결혼할 때 뭐 비 오면은 더 잘 산다고 뭐 그런 말이 있듯이 상황이 워낙 안 좋은데도 이렇게 많은 분들 와주셔가지고 이제 이런 감사한 마음으로 더 잘 살 수 있을 거라는 생각이 듭니다.
It's a little after 2 in the afternoon here in Korea, and we turn now to the regular afternoon briefing on COVID-19. As mentioned at the start of the program, the number of daily cases has dropped to 119 infections on this Monday here in Korea. Now, this marks the 5th straight day for the daily tally to stand below 200 and also stands in sharp contrast to the 441 cases noted on the 27th of August. Today, the public here is being asked to take caution against the pandemic and the season's 10th typhoon Haisen, which is making downfall here in this part of the world. Meanwhile, authorities last week extended the level 2 social distancing for the country until the 20th of September, while keeping the tougher level 2.5 distancing in place for the metropolitan area until the 13th of September. Under the guidelines for Seoul, Incheon and Gyeonggi province, restaurants, bakeries and even convenience stores will have to close their on-site dining services by 9 in the evening. They can be open for takeout services from 9 in the evening to 5 in the morning. Gyms as well as other indoor sports facilities will remain closed for the rest of this week, as will cram schools and other academic-related venues, including the so-called study cafes. And speaking of cafes, franchise coffee shops are allowed to offer takeout services only. Also, patrons to these places are being asked to leave behind their personal information, including their names and number, to allow for efficient contact tracing in the case of an outbreak. Meanwhile, to better protect the elderly who are particularly vulnerable to COVID-19, authorities have asked family members and friends to refrain from visits until the 13th of September and to opt for virtual calls if possible. Public transportation is also being affected by the latest tough measures as nighttime bus operations has been reduced by about 20% after 9 in the evening to discourage late outdoor engagement.
9월 7일
Here now is the briefing. We will come back to you afterwards.
시작하도록 하겠습니다.
Let us now begin our regular briefing for today.
먼저 정은경 본부장
First, here is Director
설명드리겠습니다.
Chung Eun-kyung with the explanation. Let us now begin our regular briefing on the COVID-19 response here in South Korea. As of September 7th, Monday, we have 108 new local infections and 11 new imported cases. The total caseload now stands at 21,296. Currently, we have 4,663 people in quarantine and 162 people are with severe or critical conditions. There was a slight decline and there were 2 additional fatalities. I extend my deepest condolences to the deceased and the members of the bereaved families. Let us now look at the updates on our domestic infections by region and cluster. Related to August 15th Seoul rally, we have 5 additional cases being confirmed. In total, we have 532 cases being confirmed to date. In Seoul's Gangdong-gu district, we have the Seoul BF mobile telemarketing call center. We have 2 more people being confirmed to date. In total, we have 18 confirmed cases to date. And in relation to the metropolitan area hiking online club, we had the first case in early September, and we have 4 additional cases, and a total of 5 people have been confirmed to date. In Gyeonggi-do province, in relation to a family and plus the Eugene appliances, we also had the first index case in early September, and we have additional cases being confirmed. In total, we have a total of 15 people being confirmed. And in relation to a restaurant in Malbao market in Gwangju City, we also have 10 additional patients being confirmed. In total, we have 11 cases to date. And let us now take a look at our imported cases. We had 11 of them reported today. 4 of them have been reported through points of entry, while the rest 7 have been reported through self-quarantine. We have 3 from the Philippines, 3 from India as well, and 1 from Africa. And let us now look at the risk factors for the previous 2 weeks. We have seen a daily increase of daily cases of about 204, and during the past week we have daily average cases hovering at around 218, which was a decrease by 100 compared to the previous week. And we had imported cases of 11.5 on an average daily. And we had seen a slight decline in the age group of 20s and 30s, and we had a slight increase in the number of patients in their 60s, and this has been on the rise steadily. And during the past 2 weeks, we have on average 82.4 cases of severe or critical conditions, which was a slight increase from the weeks before, and currently the death toll stands at 336, and 326 of them, or about 97%, had underlying illnesses. And we also have over the age group of 80, we have about 16% of fatality rate, and over the age of 70, in the age of 70s, we have also a high fatality rate as well, and about 100 people in their 70s have passed away. And we have seen that 43% were related to domestic cluster infections, and we have 21% which are under investigation, accounting for about 821 of the total cases. And we also seen venues like the churches, multi-use facilities, door-to-door facilities, and their investment seminars, and also many small group meetings were the sources of cluster infections. And looking at the transmissions domestically, in order to curb the spread of the virus, we ask you to take particular precautions, and abiding by such quarantine measures is very important. As for religious facilities, we ask all of the services to be switched to non-face-to-face means, and all of the meetings, events, retreats, and gatherings, as well as meals shall be avoided. And also, as for the facilities that are frequented by elderly citizens, including nursing hospitals and nursing homes and health clinics, we ask you to have a strict control on the number of visitors. And as for the managers and workers who work at these facilities, we ask you to refrain from going to high-risk facilities. And if you have suspicious symptoms, please get tested as soon as possible and wear face masks at all times, and also abide stringently by the quarantine measures. As for the door-to-door sales facilities, there have been many events targeting mid to senior citizens, and there were also information sessions on bitcoins, as well as real estate and also health supplement products, and they are also carrying out steadily. And we ask the mid to senior age citizens to refrain from going to these facilities and investment and business promotion seminars. And as for the multi-use facilities, the area needs to be ventilated on a regular basis, and all of the managers and staff members, as well as users, need to wear face masks at all times. And we ask all of the people to refrain from making outdoor travel, non-essential travel, that is. And also, if you are going outside, please wear your face mask at all times, and you need to cover your nose and mouth completely when you wear face masks. Moreover, it is very important to keep a healthy distance with others and to avoid going to confined, crowded, close contact environments which are poorly ventilated. The KCDC would also like to note that we have been analyzing the genetic nuclei of the 704 people's samples, and globally we have seen in April SV strains of the virus being spreading in the country, and now we are seeing GH, GR, and so forth, and these viruses are spreading now through the country. And this has also been the same case of Korea. We have seen S and V in April. However, now we are seeing strains of GH and GR, and we have identified all of the 700 or so cases were GH strains as well. And these samples were related to the Seoul rally on the Liberation Day, as well as the church in Cheonan City, and also a group meeting in Busan. And there were some major clusters, and we have collected the samples from these cluster infections, and we have confirmed that all of them had GH strains of the virus. And the KCDC would like to also announce to the public that we are preparing for a simultaneous spread of the virus, COVID-19 as well as influenza, and we will be providing free of charge vaccinations against influenza as well. And starting from 8th of September, we start the vaccinations from the toddlers above the age of 6 months and below the age of 9 years. And if this influenza vaccine is administered for the first time for these age group, we also would like to note that they are the first groups that will be targeted to these free vaccinations. And this year, until last year, we also had had the targets of 6 months to the age of 13, as well as pregnant people, as well as senior citizens. However, it has been extended to include all of the school students, whether they be primary, middle, and high school. And we will also expand the scopes given to the senior citizens as well. And covered by the National Health Insurance, until last year, we had these 3-strain vaccination that were available free of charge. However, this will be switched to 4-strain vaccination. And among the children aged between 6 months and 9 years of age, these children need to get vaccinated twice, and it is very effective to get the first rounds of vaccines starting from September 8th. And also, as we have a larger target of the vaccination, we need to also ask you to keep a very safe environment when you get the vaccinations, and we will have different age groups targeting on specific days. And there are about 10,000 health clinics nationwide that provide these vaccinations for children, and they are free of charge as well. And we believe that each of the clinics have different supply of these vaccinations. So please make reservations before you visit these clinics, and you can also check the status and the supply of these vaccinations doses through smartphone application as well. And it is most advisable for you to reserve in advance before visiting these hospitals. And starting from this year, we also have the report on the making of these reservations. So please take use of that as well. And as for those people who have suspicious symptoms of COVID-19, we ask you to refrain from going to these vaccinations as well. And before you visit these hospitals, please wash your hands and wear your face mask at all times. And today, our on-day increase of the new COVID-19 cases stood at 108 as for new local infections, and we have been seeing the number staying at the 100s for 5 straight days. Of course, we have to factor in the lower number of testings conducted over the weekend. However, we have seen a slight decline. However, we would like to highlight that this is not a time for us to become complacent and relieved. However, in August, we also had the numbers peaking at about 300 to even 400 sometimes, and we believe that we have been seeing the peak of the second wave, and these were also all possible thanks to the efforts and endurance put forth by the members of the public, and as well as the discomfort embraced by the self-employed and the practice made by the religious circles, as well as the sacrifice and dedication put forth by the medical practitioners as well. So we believe that everyone in different circles of life have exerted their full efforts to contain the virus, and these results are now becoming visible by stage. And we would like to also note that many of the public are expressing concerns, and they're worried about the situation of a lengthened walkout of medical practitioners. And we believe that we would like to express our pity and for this as well. However, we have seen a slight decline in the number of the on-day increase, and we believe that this week also should be a week of experiencing and practicing intensified social distancing. Please refrain from making outdoor gatherings, and please cancel your meetings as well, and please wash your hands, and please keep a healthy distance with others. And as for those in the high-risk group, including those with chronic illnesses and senior citizens, we ask you to also take particular precautions. The quarantine authorities will also continue to exert our full efforts to protect the high-risk group going forward. Thank you very much.
기자님들 질문에 답변 드리는 시간 갖겠습니다. 먼저
Right, that was Chung Young, the head of KCDC, with Monday's afternoon briefing. So, do give us a summary of her address.
All right, well, let's start with her 2-week assessment of the coronavirus here in the country. Around 275 cases were reported on a daily average, and there's been a decline in younger patients, but an increase in elderly people that have been infected. In fact, more than 30% are people aged 60 and above, and there's been an average of 82 people in serious or critical condition on a daily basis. And as of this Monday, at least 160 people were in such a condition. And also major sources of infections were places of worship, multi-use facilities, as well as medical facilities. And according to Tong, as we are now in the month of September, the government is planning to provide flu shots for the nation's people, for some 19 million people. And depending on the age groups, some age groups will be prioritized, such as children. So she asked for the nation's people to make reservations in advance to get those vaccinations.
Right, so thank you for that. I'll see you again tomorrow.
See you tomorrow.
Right now, not only is the pandemic affecting social events, it's also blowing winds of change in the sports arena. Last Friday, that would be September 4th, was Taekwondo Day. And in this next corner, I have the head of the World Taekwondo, Cho Jung-won, live on the line. Welcome to the program.
Thank you. Thank you for inviting.
Right. I'll start with a bit of background for the sake of our viewers. I believe it was in the year 2006 that the World Taekwondo Foundation designated September 4th as Taekwondo Day to mark the day when the International Olympic Committee included this Korean martial arts as an official sports event. I understand celebrations to mark Taekwondo Day this year were held virtually. Please do tell us more.
Yes, especially this year's Taekwondo Day is very significant, because Taekwondo is in the Olympic Games for 20 consecutive years. We were very happy to receive also a video message from Dr. Thomas Bach, IOC President. He thanked World Taekwondo for being a reliable partner of the IOC in spreading the Olympic values. And also he mentioned Taekwondo is more than sports. And especially our member national associations also celebrate their own ways. For instance, especially the Iranian Taekwondo Federation organized an online international seminar for thousands of Taekwondo people around the world. And we also used social media to connect with our stakeholders and general public who love Taekwondo.
Tell us a bit about the changes in your schedule with regard to Taekwondo amid the pandemic.
Yes, I'm supposed to be in Pokhara, Nepal to attend the Everest Open Taekwondo Championships. But since last mid-March, I'm staying home and staying in Seoul. Because of a pandemic situation, I cannot go out and I cannot go abroad. But I get to stay home and have time to plan for myself and think about World Taekwondo's future. I see this as an opportunity to reset our office operations and be more sustainable.
Meanwhile, the decision to postpone the 2020 Tokyo Olympics, I hear, involved navigating through complicated discussions. Could you share with us some of the challenges faced at that time during those discussions?
Yes, last February, the IOC, the decision taken by the IOC and Tokyo 2020 Organizing Committee to postpone the Games was a very difficult one, especially for international federations that rely on the Olympic Games. But it was absolutely necessary to protect the health and well-being of everyone involved. All the stakeholders stood in solidarity with the IOC to make this difficult decision. Looking at the current situation around the world, it was the right decision.
Right. Simply speaking, how much of an impact has COVID-19 had on the sport of Taekwondo?
A lot, because all the dojangs around the world has to be shut down, and also all the important competitions in national level and continental level and also world level has been cancelled. So especially for World Taekwondo, we're supposed to have a World Junior Taekwondo Championships in this coming October, but it's cancelled. And also every end of the year, we are having a World Grand Prix final, and it's supposed to be held in Mexico, so it has to be cancelled. And another one major thing is a Grand Slam event in Wuxi, China. It also has been cancelled. So all the Taekwondo families very suffering from the pandemic situation.
I see. What efforts are being made to ensure a safe Taekwondo experience then?
Especially the Taekwondo, as you know, that we have a Gyorugi and also Pumse. So we are planning to organize World Pumse Taekwondo Championships in virtual way. So online, but Taekwondo Pumse Championships in this coming November. And also we are following the guideline, the safe returning training and competitions for our athletes based on discussions with the WHO and other medical experts. So all future Taekwondo events will need to go through strict medical protocol to ensure safety of athletes, officials, and spectators. So one option is to have competition without spectators. Actually, this is not a preferred option, as spectators play a critical role in contributing to the positive atmosphere scenario that all sports need to consider. So that's why I mentioned already, so we are going to organize first ever virtual events.
Can Taekwondo serve as an effective way to enhance one's mental health amid the pandemic?
Yes, so we are now, the Taekwondo is one positive during this pandemic. It has been the Taekwondo has demonstrated it still has the power of inspire and entertain even during times of great difficulty. Now, more than ever, when we stay home, Taekwondo helps people to keep fit and stay mentally positive. So we should not underestimate the effects of mental stress on athletes and general public.
Taekwondo, I believe, was selected as an official sport in the Tokyo Paralympics as well. What are some of your future plans for Taekwondo?
Well, we were very excited about the Para Taekwondo especially, making its Paralympic debut in Tokyo. But this makes Taekwondo one of the most inclusive sports in the world. We intend to expand our online education courses to all stakeholders. We are also exploring ways to organize more urban and youth-oriented events that cater to the public. So we are also developing esports applications. Very soon we will launch our apps, and we hope that it will be a springboard to engage with the youth and general public who might not have a clear understanding of Taekwondo.
All right, then thank you for your dedication and thank you for making the time to join us with your thoughts today.
Thank you for having me. Thank you.
우리 방역망의 통제력을 회복하고 의료체계의 치료 여력을 확보하기 위해서는 신규 환자 수가 뚜렷하게 감소할 때까지는 거리두기 조치를 연장할 필요성이 있습니다.
There is a trend that's repeating itself throughout the world amid the pandemic, a surge in cases following holiday weekends. Now, Korea is striving to contain an outbreak following its National Liberation Day holiday weekend in mid-August, while the U.S. is bracing for a spike in infections after the Labor Day holiday weekend, which ends on this Monday. For more on the situation here and in the U.S., I have two guests, both with me virtually. Professor Lee Hoon-sang from Yonsei University. Good to have you back, Professor Lee.
Thank you for having me.
And over in the US, I have Catherine Ellen Foley, a health journalist. It's a pleasure to have you with us, Catherine.
Thank you so much for having me.
Professor Lee, let's begin with the situation here in Korea. After surging to more than 400 cases in late August, the number of daily cases has been hovering below 200 for the fifth straight day, with 119 cases today, that is Monday. What is your assessment of the situation in Korea?
I think this situation is much better than having the daily cases above 200 or up to 400 to 500 figure. However, still we have around a little bit more than 100 confirmed daily cases, and we have yet to see if we can decrease it down to under 100 or down under to 50 daily confirmed cases figure, which will be eventually the interim goal of the KCDC at the moment. Also, although the number of confirmed cases has been brought down to hundreds figure, if we are seeing a slow increase in the positive test rate again from around 1% to 2.2% as of yesterday. And also, besides, the number of death cases has been steadily happening around 3 to 4 cases figure. Also, the social distancing level 2.5, as the social distance 2.5 level extends, we are also expecting Chuseok as well, the Korean Lunar New Year coming, so which may again increase the case. So I think it is just not a time to let our guards down, and I think we still have to be watchful for the development of the situation, because the situation can escalate at any time.
Right, the Chuseok holiday is referring to the Thanksgiving holidays 3 weeks from now, right, Professor?
Sure.
Right, Professor, when can we expect to see the tangible effects of the level 2.5 social distancing here in the metropolitan area, which was imposed first on the 30th of August?
Well, I think we are, in a way, seeing some of the effect of the level 2.5 social distancing measure in bringing down the cases from the 440 daily confirmed case down to 119 cases as of yesterday. I think it is the effect of citizens' voluntary participation in social distancing, which are having the impact as well. However, to see the full effect of the social distancing level 2.5, I think we still will have to wait for another week, especially as we are having the community transmission of the infection with about 21.5% of the confirmed case being the case of unknown origin. We will have to see if this will indeed interrupt the community transmissions.
I see. Meanwhile, Catherine, I understand authorities in the U.S. pleaded for public vigilance ahead of the long Labor Day weekend to prevent a repeat of the scenarios witnessed after the Memorial Day celebrations in late May and the 4th of July festivities. What is the overall situation in the U.S. like right now?
You know, it really depends on where you are. It's funny that you mentioned Memorial Day. That's sort of seen as the unofficial start of summer and summer activities here in the U.S. And Labor Day is always seen as the unofficial end of summer. So I think you're right to expect that a lot of people will be enjoying nice time outside. Where I'm based or where I am, we've had a lot of really nice weather. So I'm sure there have been lots of people outside enjoying that, doing things like biking and running and playing sports. I think what it really comes down to is if they're making sure they are maintaining social distance as they carry out these activities. And it really just depends on where people are across the country. Where I'm based, masks are still required outside, with the exception of doing vigorous activities. But in other places, either enforcement isn't as stringent, or there simply aren't those requirements. So it really depends on location in the U.S. and it depends on the activities.
I see. Meanwhile, Catherine, a new study by the University of Washington forecasts that more than 410,000 Americans will lose their lives to COVID-19 by the end of this year. Please tell us more about this study and perhaps about the efforts being made to address this rather frightening forecast.
Yeah, absolutely. It is a really frightening forecast. The folks at the University of Washington have been one of the larger groups creating these COVID projections. And that figure of 410,000 deaths is really looking at if the U.S. continues to see cases the way that we are now. So assuming that we don't get more stringent with social distancing measures or mask requirements, there is a figure on the higher end of that scale that looks at if states and other local governments ease up on social distancing requirements. And in that case, the researchers predict that we could see as many as 620,000 deaths. So that's sort of like a worst case scenario. On the other hand, if there is something like a universal mask law or mandate provided across the country, maybe those deaths would be as low as 288,000. So it's a really big projection. And some other researchers at other institutions have been critical about, how far can we actually predict out what COVID death cases are like. The end of the year is still a long way away. So it's certainly a striking model, and hopefully public health officials will be able to use it to inform what decisions they want to make for their populations.
Professor Lee, in related news, what are your thoughts on the isolation of those who suffer from diarrhea and vomiting?
So with doctors' consultations, having the symptom of vomiting and diarrhea, I think maybe it may not be strong enough evidence for isolating them right away, but at least for giving them the chance for the testing. Especially among the children, in a number of studies, it has been found that the overall symptoms in children are milder, but some of the children may manifest gastrointestinal symptoms such as nausea and vomiting, diarrhea, and stomach ache. Thus, as the research by King's College in the UK says, it might be worthwhile to speculate for possible COVID-19 infection if it is deemed necessary by a doctor to test for COVID-19, especially among the children. If there are gastrointestinal symptoms such as vomiting and diarrhea, even though there is not much of fever or respiratory symptoms.
Catherine, I'll take your attention now to the after effects of COVID-19 as suffered by those who have survived. Now, the list includes loss of hair, loss of smell, loss of taste, as well as skin problems and more. What are some of the latest findings in the US with regard to the after effects of COVID-19?
That's a really great question, and I think it's one that researchers are still beginning to explore. So, as you said, there are a lot of individual patients who are reporting having symptoms that have persisted for weeks or months after the expected duration of a couple of weeks for these so-called mild cases, and even longer in more severe cases where patients are hospitalized. My understanding is that some researchers have started to look in this. There's one study that began in June that's been funded by the U.S. National Heart, Blood, and Lung Institute. And as I said, that started in June and is really an observational study looking at individuals who've had both mild cases of COVID and those who have been hospitalized. So in that case, researchers are taking, all kinds of data on these patients and looking at their blood, looking at their cardiac function, looking at their urine to see what all of the effects of COVID are. This is still a relatively new virus, despite the fact that it feels like we've had it for forever. So there is still ongoing research in that field, and I'm excited to see where it goes. But I mean, as of now, we don't have any conclusive ideas of what long COVID symptoms look like for everybody.
Right. Professor Lee, where does the world stand with regard to vaccine development? We have the World Health Organization talking about vaccines being available possibly mid-next year. We have US President Trump talking about a vaccine being available next month. What are your thoughts?
I think next month, I'm not really sure if we are on the safer end to really test, to be sure about the safety. What is important is not just the efficacy, but the longer-term safety, because if we have this vaccine available and if we start vaccinating the global population, we are talking about the figure about a couple billion population globally. So I think I would agree with institutions such as WHO about possibility of having the ability sometime middle of next year. However, according to WHO, there are currently 176 vaccine candidates with 34 of them in clinical trial as of September 3rd. And according to the scientific journal Nature, as of September 4th, there had been about 321 vaccine candidates identified, with 32 of them in clinical trial. Of these candidates, 6 are in phase 3 and 3 are in phase 2. And of these 32 vaccine candidates, there are plans to enroll more than 280,000 participants from at least 470 sites in 34 different countries. So there are massive efforts to develop vaccines. And also there has been large-scale manufacturing of vaccine has been already in preparation to enable rapid distribution if approval is obtained. So I'm pretty confident that we would be having some of the vaccine candidate ready sometime by middle of next year, or at least by end of next year.
Well, that is good to know. All right, Professor Lee, as always, thank you for being with us. And Catherine, it's a pleasure having you with us.
Thank you for having me today.
Thank you for having me.
Right, on that note, we end Monday's edition of COVID-19. Be sure to join us tomorrow as we further explore the legal consequences of violating the government's containment efforts. In the meantime, do take care amid the pandemic and the typhoon here in this part of the world. Thank you for watching.